You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, it's a Smile Makeover show. How small improvements to your smile can make a big difference. According to my first guest, it can actually change your life. From Hanford, California, he's the Central Valley's cosmetic dentist, Dr. Nagrani. Dr. Nagrani, welcome to the program.
Thanks for having me, Randy.
All right, now before we get into today's topic, and I know you brought some photos and you're very proud of the photos.
Yes,
but for people that don't know you, tell us a little bit about your practice. What are the different procedures you do? And who's the typical patient?
Well, I've been in practice for 17 years now, and you know, the really good thing about being a general dentist, I get to see everybody.
All right.
I'm a family dentist. I get to see families. We've got, you know, everybody from the whole the population. It spans. We've got electricians, we got plumbers, we got firemen, we got teachers, we've got students, we've got doctors, we've got nurses.
Now, people don't like going to the dentist, right? I mean, do they tell you that? Do you hear that all the time?
All the time.
What do they say? Like, how do they break it to you?
Oh, you know, I ask them how they're feeling when they're there. They say, I'd rather be somewhere else, you know.
Do they really say that?
Yeah, and you know, people don't mean that in a mean or nasty way at all. It's just a natural human emotion when you're afraid or fearful about a certain situation, and you let it be known. And I prefer the honesty.
Now, you're a dentist. Of course you think, respectfully, that the smile's important. Maybe even the most important thing. I mean, how important is a smile, in your opinion?
Obviously, I think it's very important, but ask anybody else who's in a power position to tell you about what looks good or what not. You know, let's take magazines for examples. You know, we have Muscle and Fitness in our waiting room, our lobby. We've got Elle, we've got Cosmopolitan, and all of them have done their own research surveys. You know, ask people what they find is attractive, for example. Okay, let's start with attractiveness. Amongst other things, the top 10 qualities what both genders, male and female, would find attractive. And on the top 3, and in Muscle Fitness it was #1, was a smile for both.
Is that right? Even Muscle Fitness, you would think physique, but smile.
Right. You would think bigger biceps or you know, firmer, whatever. And it was smile every time, if not in the top 3.
Now, in this economy, do you find people investing in their smile?
Absolutely.
Or wanting to take care of their smile?
Absolutely. And you mentioned because of the economy, there's a lot of people in the job market. So they're interviewing, they're looking for jobs. They want to look good. I mean, you take 2 people who, let's say twins. Yeah. One has got broken down teeth and one has got perfect teeth. Chances are the one with the broken teeth is not even smiling at this point, but they're both sitting in the same interview.
That's a good point.
Who's the job going to go to?
Well, you do. I mean, if one's smiling and one isn't, attractiveness aside, the one smiling seems more positive.
Sure. You know, it's you know, we're humans, and so we make judgments. Psychologists will tell you within the first 5 seconds of meeting somebody that you've never met before, you've made a judgment of some sort. You know, you've made an opinion, and you want to be on the side of a positive opinion right away. You know, because you only get one chance to make a first opinion.
You say, we've talked, that you're changing people's lives. And I said this at the top of the show. I mean, do you believe that? I mean, do you see that happening?
I see that all the time. I wouldn't have believed it unless I'd seen it myself. Okay. And so let me give you some examples. We've had patients, you know, and this one lady stands out, young gal, pretty. She had some stains on her teeth. They were kind of crooked. She was never comfortable with her smile, going through high school, and you know, kids can be brutal then. So, she was stigmatized with that. And somebody might have mentioned something about her smile not being perfect in school, well, in not so many words, or maybe in more words. And so that stayed with her for a long time. And now she's married, but she's still very conscious about a smile. But she doesn't know what she needs to do about it, or if she can change it, or if she's just going to live with it. You know, so she's kind of depressed about it, and more of an introvert. And then we offer her with options, and then we change her smile ultimately to something that she's just elated. She sees it, she jumps out of the chair, she can't stop looking at herself in the mirror right off the bat. Maybe long enough.
Do they tell you this, by the way?
Oh yeah, I mean, well, they give us a hug and then go back to the mirror again. You know, so that's just rewarding for us, and we know we've done our job when we get that hug. Especially, I mean, obviously, I want to be sure I like it first, but the icing on the cake is when the patient starts crying.
I
love my smile.
So when they see their teeth for the first time, sometimes it gets emotional?
Oh yeah, and then you see that patient after, because that patient has gone so long not knowing how to smile, not wanting to smile. So that transformation takes a while. First you have that beaming, you know, self-realization, this is me. I want to go out and improve the other aspects. You see them getting a tan, you can see them doing their hair, nails, and everything else after that. And then the personality follows from there. The person becomes more of an extrovert, you know, more social life. You know, they've marked on their health history form they were single, and now they've got a boyfriend, or they've got other contact info. You know, and we ask, you know, who should we contact in case of emergencies, for example. And before there was nothing, maybe a mother or father, and now there's another person,
and
a male.
You think it's because of their smile? Possibly.
Yeah, could it be a coincidence right after that? And we've seen these patients
there's no doubt about it. I mean, you know, since we've talked on the phone, you walk around, and the people smiling, they're more approachable, no doubt about it.
I got another story about that.
Okay, okay.
Well, this gentleman, he's been in our practice a while, and he was not comfortable with his teeth also. Again, you know, smiling. He's a realtor, so his job is to approach people and make a good impression. Okay. There's a lot of realtors out there, and so he wants to be the one to represent you. But he was never comfortable in those shoes doing that until we fixed his teeth. Now, we did not know this going in, you know. A lot of people don't want to talk about this stuff. But it's afterwards, you know, even a few years after that, we asked them, you know, yeah, you're happy with your teeth. Obviously, we saw that. They were really thrilled with what they got, and they couldn't stop talking about it. They send us more patients, their family of friends. And then so I asked him, well, you know, Joe, tell me exactly, what impact did this make on your life? And he goes, you know, as a realtor, I could never approach people.
Interesting.
I held back from doing this, and now I can. I feel so nice being able to do that, that I can fulfill myself, what I'm doing, my profession. I can take it to the level that I want to before. There's nothing holding me back now. You know, so it makes a very deep psychological impact on a person's nature here.
Now, we've talked, you say that just small things can make a big difference.
Oh, yeah.
And you want to make sure that when you came on the show, and I think I need to mention this, that it's not just about veneers, and it's not just about, but the small things. Elaborate on that, what you mean by that. Small changes to the smile. Now, what are the categories of cosmetic dentistry as you see it?
Okay, let's start with something as non-invasive or simple as bleaching, whitening your teeth.
Okay.
Okay, that's a take-home kit. You do that at your own pace, at your own level. Guaranteed you're going to get a change. No doubt about it, it works.
All right.
Okay, that one thing is going to make such a big difference. You know, because the darker the teeth, the older the appearance. So that ages, that brings you age right there, just simple. No drills, no shots, no nothing. I mean, it's just the easiest way to do that.
So there's an art to this, as you see it.
And science.
I say, okay.
Definitely an art. I'd say it's about 50%. You know, the science you learn in school, the art you can learn, but it takes an eye to visualize
because
that.
I feel like I could spot veneers walking down the street.
Not mine.
Okay.
I know it sounds cocky
so
to say that.
But that's in the hands of the dentist, you're saying?
Yes, absolutely. Between the dentist and the lab, you got good communication.
So you were saying golden proportions?
Yes. It is.
Is that a Da Vinci thing or something like that?
He got into that. The Vitruvian Man, the sketch, the pencil sketch about the man with his arm stretched and the circle around that, which he borrowed from a Roman architect called Vitruvius. And this is what's called the Vitruvian Man sketch. So he put in proportions of all kinds that exist in nature.
What does this have to do with teeth, though?
It exists with teeth, too, because proportions are what the eye beholds as beautiful.
Interesting, okay.
That's what it comes down to. Harmony amongst many things in a whole. Between the teeth. Right. You're looking at one tooth to the next. There's got to be harmony between those teeth. And there's a set, I wouldn't say a definition, but there's a set quantification of those ratios from one to another that makes it look good, that we perceive as good. It exists in nature. You see trees have it, plants, flowers, solar system, the Milky Way, the spirals, they're all in the same proportion.
So when you create a smile,
yeah,
you feel like you're creating a smile.
Absolutely.
It's not just veneers or this or that.
I want to use the term engineering the smile.
Okay.
Okay, because we use a lot of math. We use those proportions. We take pictures, and then we measure on those pictures the specific landmarks we're looking for. Eyes, nose, chin, lips. That gives us a starting point and where to go with the length of the teeth that we want to change, the width of the teeth from there, and the width of the other teeth from there. One thing begets another. And so we use that as blueprints. Let's call it blueprints.
Okay, I interrupted you earlier. I said the different types of cosmetic dentistry.
Yes.
Okay, so we talk about whitening. What else?
The next step up from there would be minor tooth contouring. Okay. You know, that way we just take a little bit off here, we round this up, we sharpen this up, maybe add a little bit of bonding here. So we don't really change the color if they're happy with the color, or we can do the bleaching first and then do the contouring and take a little bit of here. Very conservative. And that makes a whole difference because, again, it brings the teeth into proportions. Okay. As much as possible within that framework.
Okay. What about metal?
No metal. We don't use metal, any kinds, for anything.
Okay. But do you remove? Are you equipped to remove metal fillings?
Yes, I am. I don't do it for the sake of removing metal unless the patient requests that.
Okay.
But I do a lot of that.
All right.
It's out. It's not on its way out. It's out.
That means using metal now.
Using metal.
Amalgam fillings.
I say the only thing is if you have a partial denture, you maybe you use metal. Even there, there's options. There's alternatives to that. So we don't.
Okay.
I want teeth to look like teeth. Teeth don't have metal. Okay. I got into this to make teeth look like teeth.
And so who is the, because we're talking about smile makeovers, cosmetic dentistry, and so I guess it's all types of people now are coming in to improve their smile.
Oh yeah, absolutely.
It's not just a certain high-end demographic.
Oh, no, not at all.
Just regular people.
Everyday people, conscious about their smile. And people who aren't conscious about their smile, they know something is up. Maybe the whole nature is kind of diffused a little. We make a suggestion. We ask them. We give them. It's all about education. Okay, we don't push anything. It's this is what's available. I just want you to know, importantly, this is what you have available to you in a very easy, fast, instant way of changing a lot about yourself for the better. If you don't know what's available.
So going to get a consult.
Exactly.
And you're one of the guys that does a free consult.
We don't charge.
I wasn't really even aware that they were charging for consults. Nicole, who does all of our media buying, works with the Wellness Hour. She called one place and they had a $250 consult. Turns out that I guess that's very common. And I said, you got to be kidding me. And so you don't charge a consult. That's good.
No, we don't. We'll take all the time we can.
What takes place on that day?
A lot of chit chat. We want to talk. We want to get to know our patients. We want to see what their motivations are, what they don't like about their smile, if anything that they have seen. Okay, we take pictures because that's an easy way to look at it. Blow it up on a screen and pick out what is up. Make some measurements. What they don't like, maybe what we can change, present it to the patient as such. Look, these are the issues we're seeing very objectively. There's a lot of subjective that goes into a smile. You like it, but you don't know why. Well, we have some objective criteria that we put into there to make it a good subjective smile.
All right.
And so we plug those numbers in and we get a feel for where it should go. In fact, for the most part now, looking at somebody, I know where it should go.
So you can spot it and see the end result.
Oh, yeah. I mean, you do enough of this, you know where it's going.
All right. Now, you brought photos. What are we looking at here?
Okay. This gentleman, very interesting.
Okay.
This is the before. You can see a bunch of different issues. He has been part of our practice for a while. I was always nervous going into the room to meet him for an exam because he wouldn't smile. He was really gruff. He's a big guy. He'd just look. Good morning, and that's why he wouldn't talk much. And you ask a question and you're trying to get a dialogue going and you get one-word answers. Here's the thing, he's not like that anymore.
Okay.
It's a big change. I love seeing him. He's one of my biggest
So when you
advocates.
look at that smile, what does he say to you? What doesn't he like? He just doesn't like the whole thing, or what does he say?
Yeah, he doesn't like the way his teeth look. They're worn down, they're short, they're dark, they've got cracks in them, and he's just not happy with a smile.
So what do you see? When you look at that from a dental standpoint, artistic standpoint?
Proportions are off. Look how flat these front teeth are. It's reverse. They usually should follow the line. The lower lip.
Okay.
Okay, look how opposite it is. It's all worn down. Another thing, it's an aged smile. It's an old smile. It looks like he's a lot older than he is.
Okay.
He doesn't know this, but that's what he doesn't like about it. Okay, the color is darker. It's worn down as you age. But his smile is aged far beyond his actual age.
So he knows he doesn't like it. He doesn't really know why, but you know why.
Yeah, absolutely. You see this long enough and you know what it is and what you can fix. Okay, so we talk to him, we counsel him about what we would like to do with each one of those specific problems. Get into one harmonious smile, proportions again. So once we decide this is where we're going to go and he's agreeable to treatment, when we start treatment, the first thing we do is put the patient in temporary veneers or crowns or what it is that we're going to do. Okay, what that is simply is we've taken the blueprint of all those measurements I've talked about.
So you give them a temporary set of teeth?
Yes.
Do they look at them and then say, I love this?
All the time.
Okay, all right.
I want to say, never say never, but there hasn't been a time.
They always love their...
Yeah, there hasn't been a time when they have not liked.
So they have the temporary teeth. They go home. They show their friends. Their family.
It's a huge improvement. Oh yeah.
All right.
Now here are the things we contend with. Okay, we assume we're going to take it to this level of color, for example. It's something that you may not be used to. Maybe in your head you wanted lighter. Maybe you don't want it as light. We can change that in the temporaries. That's one way of knowing for sure.
Okay.
You don't get the final product and decide, oh, I want to change this. You've got ways of changing it before you get the final product. And so that's one of the things. Another thing is the shape of the teeth. Maybe one side is rounded, like I talked about. It should be sharper. It should be more rounded. The proportions of the teeth to each other. Is that harmonious? Does that flow well? When the patient smiles, do you see the harmony in the smile? Does it follow those guidelines? And sure, that's the best time to know. And 3 weeks later, we see the patient back and say, well, what do you feel? What do you think?
They say they love it.
Love it. What do your parents think? Oh, your family. What do your friends think? Coworkers think? Everyone loves it. Yeah, it's really nice. And so we take another mold of that, send it to the lab and tell them, duplicate this exactly. The day we put the final veneers on, you see the big change, big transformation. This is what it looks like.